Hello and good morning, or good afternoon to many of us. I'm Danielle Varda. I am the CEO and founder at Visible Network Labs. I'm also a professor at the School of Public Affairs at the University of Colorado, Denver, and I am so pleased to welcome folks today to our conversation around ecosystem mapping and tracking for population and community health. Welcome to a lot of folks that we know and have seen before and are part of our community already, and welcome to a lot of new folks that we also hope will join us in this conversation going forward. I'm going to jump right into it, especially as people are coming on. Feels funny introducing myself, but I'm going to be the main presenter today. And then I will be joined. I think we'll all be pleased to know that Dr. Glenn Mays will be joining us about halfway through. He is the professor and chair at the Department of Health Systems Management and Policy at the University of Colorado School of Public Health, and the director of Robert Wood Johnson Foundation Systems for Action Research Program, amongst many other things. But Dr. Mays has been studying ecosystems and networks and population and community health for a long time, and is a mentor and colleague and friend of mine. And I've asked him to come join us at the end to talk a little bit about that work and the way that he sees the future of it. He couldn't join us at the beginning just now, so we're going to go ahead and get through most of this, and he'll join us towards the end. So something to look forward to. So don't leave at the end if you want to hear from Dr. Mays. He's pretty great. I love to start everything by trying to understand a little bit more about who is in the room. And I'm going to have to fix this, my apologies, and figure out. So I'd love for us to do a couple of things. One, in the chat, please say hello. Let us know who you are, where you're from, maybe what you do for work. But we like to also do something that helps us kind of understand a little bit more about the actual people who we are here today. So I always love to, I call this kind of our visible us moment, where we get to spend just a minute talking a little bit about who we are, not just by our titles, but who we are as family members, what kind of adjectives describe us, what are our hobbies. There's going to be two questions, so you can either go to menti.com and put this code in, and hopefully someone from our team will also put it in the chat. You can also take a picture here, and it'll take you to the Menti, and I'll click over to it in a second after kind of getting to see who's in the room and what we can know about each other. The second question will just be a little open-ended. How do you define ecosystem? As you can imagine, we struggle with this. We're going to attempt to do this today, but it's our moment here to get some feedback from all of you to try to understand a little bit more about how we talk about ecosystems. So what I'm going to do is actually leave that and come here, and let's see if we are getting any responses in here. So I think that it'll work as soon as I'm here. I always wonder if these are going to work as soon as I start them. But let's see, if anyone has already put something in and it's not working, let me know. Or if it's not going to this question. Okay, well, thank you for
having a hard time with it. There we go.
Okay, excellent. It's working for one. So thank you, there we go, whoever's just gotten it started. This is one of my favorite parts, because we go to so many webinars and we look at each other in these Zoom boxes, and we even get our chance to see our titles, but we don't often get to necessarily see who we are. Just kind of as people in a community of folks who do this kind of work and care about these kinds of processes and outcomes. So thank you for putting all these in here. I don't know who put AmeriCorps Vista, but I was an AmeriCorps member for 2 years as well, and then sat on the National Advisory Committee, Advisory Board for the NCCC. So good to see another AmeriCorps person in here. So we have a New Yorker, uncle, mom, hiker, brother, dog, mom. Excellent. Okay, we'll just do this for a quick minute, and then we'll go to the next one. I know as soon as I click off this, I think it won't let you do this anymore. So Excellent. Okay, well, thank you. I'm glad there's an eater here. Maybe we're all just coming in and out of lunch right now. Okay, I'm going to switch to the next one, which is also a, well, it's not letting me, there we go. So in this question, that it's just, how do you define ecosystem? So let's see what some of those are. So these are just coming in as open-ended answers. So a set of interconnecting parts contributing to shared goals. Grammy, another creative. I think we got one answer here from the other question. Lots of systems of interconnected things, healthy balance of different systems working together, connections through a community, region, or other geographic area. This is wonderful. Thank you. And I'm glad to see that I think a lot of us are here on the same page. And how we're thinking about ecosystems. I think a key part of this is the interconnectedness. So it's a set of things that exist, but the interconnectedness of them is what makes it especially interesting. All right, well, thank you for interacting a little bit. If you still want to input some things there, I think you can, even as I take this down, and we'll come back to it. And as we send out the slides, we'll share these with everyone so that you'll have access to some of these answers as well. And thanks again for introducing yourself in the chat. It's always great to see everyone who's here. Okay, I'm going to get right into this. I'll talk just a little bit about Visible Network Labs for a moment. This is an organization that I founded about 5 years ago, but prior to that, I was at the Rand Corporation for some time and as a policy scientist, and then I still am at the University of Colorado, Denver, where I've run the Center on Network Science. But Visible Network Labs is a accumulation of a lot of work and funding from different foundations and grants and contracts and our ability to build out a platform called Partner that I'll show you a little bit about. And it's very research-based. We did most of this work of development while at Rand and at the university, but years ago brought it out so that we could start a social enterprise. And that's what Visible Network Labs is. It is our mission to make invisible networks visible. We know that all of the kinds of connections around us matter, and they are meaningful and they impact outcomes, but they're usually invisible, not only to us, but people trying to help us. So we've seen the power of making these things visible, also measuring them. And so we're just constantly trying to figure out how to take complexity and make it simple, and also figure out how to measure really hard to measure things. There's a wonderful group of people who are behind this work, who wake up every day thinking about how to strengthen social connectedness at both the systems and individual levels. And ultimately, our hope, our vision is that everyone has the social support that they need. And whether that's done through systems building or individual identification of a person's needs and gaps in their social support, we try to do all of that work. Okay, so today, I just wanted to kind of lay out what we're going to do. We're hoping to do a little bit of a background on understanding how we can apply network science to this world of ecosystem tracking and systems thinking to analyze and optimize primarily public health and community health interventions. We want to discover how to do things like identify key stakeholders, partners, resources, and leverage these things so that we can create stronger community health ecosystems. Really important to this work is showcasing our return on investment. So we're putting a lot of investment time into building networks and networks of networks that become ecosystems. And it's challenging to know if they're working. So we want to talk a little bit about that. And then talk about how we utilize this work to strategize and build out action steps and think about ways to foster collaboration and build partnerships. We know that legislators are legislating this, funders are funding it. We have all kinds of network strategies happening, but we don't necessarily have all the tools to do that work. I wanted to start out by talking about how we use network science as a unique lens. It adds a little bit of data and some technology to the work that we do. So I'm going to back up for just a minute and talk about kind of why we're here. We know there is a new norm. I don't even know if it's new anymore, but it's really the network way of working. we have this slide for when I first started this work used to say a new paradigm, but we're way past that. And now you really can't be part of an organization without being expected to think about how you reach outside of that organization to find resources, work across boundaries, and figure out how to actually join these kinds of networks that are surrounding us to bring leverage and resources back to the work that we're doing. The challenge is that we don't really have resources and tools for that. Most of us went to school for something else, or we practice different kinds of epidemiology or public health practice, or one of the partners in the community, but many of us are introverts. We don't all know how to go about the network way of working, but many of us are being asked to do it every day for our work. So what we're trying to do in the work at Visible Network Labs is think about how to provide resources for folks who are engaged in this work. One last thing around kind of context. When we all went through COVID and there was so much tragedy related to it. However, there were some things that also occurred that made it something that brought some strength to the work that we do. COVID really made us all network scientists overnight. So I remember the day when we all got a message that we needed to start thinking really hard about who we were going to connect to, what was the cost and benefit of those connections, how do we construct them, should they be closed or open networks, and what was the risk of expanding that network, and was it worth the rewards? And simultaneously, these kinds of pictures that you're seeing on the screen started showing up everywhere, and all of a sudden I started to kind of be surprised by the fact that people were having network scientist kinds of conversations all the time. Network science is really just the science of how things are connected. And we, as a global community, had to have conversations about how we were going to do this work. So this is the work that we do at Visible Network Labs, but what happened really was that people became systems thinkers really fast, and ecosystems became less of a confusing thing and more of something we can all agree on, as we saw by the Mentimeter, in a shared definition. And more importantly, people realize I can measure this and I can get data on it. So, and I can visualize it. And so that's really changed the way that we kind of were able to communicate and think about this stuff. I'm going to use the word networks a lot, so I thought I would just normalize this for a moment, define it. When I say networks, I literally mean these nodes and lines. Some of us call these collaborations or coalitions or collective impacts. But we measure all of them as networks with these nodes and lines. The nodes can be organizations or people or events or beliefs or places, and the lines between them are often the relationships. So how we understand this is really what we mean by starting to understand an ecosystem. So you'll see in a moment when we look at kind of the evolution of how work has gone around the network way of working, you'll see that this has gotten even more complicated in the way that we think about it. And the last thing that I will bring forward around network science is really just a little bit of a translation of this into practice. And so if just for a minute, you can look at the center and see these squares and circles and imagine these are, say, community organizations that are partnering around a topic. But we've seen often, you'll see this is called the life cycle of a sustainable network, is that organizations come together to do some work. They start the network way of working. One of the first things we do is bring the usual suspects together and create some list of folks that aren't currently at the table. Very quickly, we get to phase 2, where we'll introduce people to our work and ask them to be involved. Phase 3 is where my team and I meet most of our networks and communities, and that's where they're focused on growing the network. But what we know is that folks here in phase 3 are also struggling with sustainability and engagement. They aren't really sure what the end is. They're not necessarily seeing the outcomes that they want, but are doing everything right. They've got people together, they're connecting. So what we try to help folks think about is how to kind of get to this stage 4, where maybe you have the same group. One thing I didn't say is these nodes and in the center here don't move in every single picture. So the only thing changing is the way that they are interconnecting, the way they are relating to each other. So in a phase 4, this is where folks are often working in a more strategic way, where let's say we have 4 people who are our main communicators, 4 work groups that meet at different times, maybe once a week, once a month. They all get together once a year. But what we are trying to do is help people think about actually how to gain the same collaborative advantage with using fewer resources. So how do we invite folks to fewer meetings, give everyone a role, and only invite them when they have option to play that role, and really use the values and trust that we've established, and the authenticity of our process to basically get to the same place, the same outcome with fewer resources. So the reason I bring this slide forward here, well, and we're about to talk about this at scale, is that we know folks just coming at this saying more is better, building bigger ecosystems, more interactions. It's not a solid solution. It's actually an overwhelming solution. In population and community health, we are working with a lot of organizations that are very resource strapped. So figuring out how to maintain that collaborative advantage with fewer resources, less asks, can actually give a sense of relief for people, and actually be more sustainable and successful over time. So we want to be sure that we're not coming at this with a more is better approach, but a real kind of network science and strategic lens, and to really talk about how we can get data to think about these things. So I'm going to talk for just a moment about ecosystems more generally, and how we've moved from really thinking about these as what I call a one and done to an ecosystem data tracking and learning environment. At Visible Network Labs and the university, I've been doing research on what makes networks effective and how they are structured for almost 20 years. And what we have been very successful at doing is really thinking about how to help folks look at those networks, measure them, and then describe them and link them to outcomes. That was often done in what we call a one and done, a one-time evaluation. We capture that, write the report, and turn it over. There was a time when I was sitting at a funder's office, and I remember she pointed to a whole pile of binders and reports and said, those are all of our network evaluations, and we don't know what to do with them. We're not looking at it in a larger way. So, we're limited. And that is when, years ago, I started thinking a lot more about how we can think of these as whole ecosystems and how they track over time. And it's really kind of matched on to the way that the history of our partnerships in public health, community health has evolved. So let me get there through some of these pictures. So kind of early prior to the 90s, but in the 90s is when some of this work around population and community health became more increased. There was more increased in partnership approaches. We started to hear about the 10 essential services of public health, which number 4 said community partnerships is a way forward. Fast forward, we know that the FAB accredits public health departments on one of the measures of how well they have built community connections. So this strategy started really pushing forward early on in a field like public health that was more formalized than almost in any other sector. So what we saw was this real push for public health staff to start building partnerships as part of their work. And this was a lot based on this idea of counting noses, of trying to get more partners in there, and this idea that more is better. So one of the methods by which people were able to capture this is through spreadsheets and lists. And so that's kind of where we started. And when I came onto a lot of this, we were talking to people about how they were just keeping track of who they were connected to. But into the 2000 all the way up to about 2020, we started to see a real difference in how we were connecting to folks. And this idea of networks started to really rise up as a strategy. Collective Impact came out with a framework that helped people see that way forward and know what to measure. But what we continued to see was a lot of, for example, we're using public health staff here, part of usually facilitating and helping to launch these networks, but they weren't very interconnected. So the work that my team has been doing for a long time has been here at this network level of really helping these kinds of organizations measure what they're doing and their impact. And where we are kind of now, that allowed us to answer some really important questions. So these one and dones, which are great, and we've done them for years, allow us to answer some really important questions about these kinds of relationships, just like how should organizations invest resources to build these new partnerships? How are cross-sector partnerships leading to health and well-being outcomes? So there's a lot of work. Our speaker later, Dr. Mays, will talk a little bit about this. This is work we've been doing. But things have gotten really complicated. And if this picture is making you go, oh no, not one of those pictures, that's exactly how we felt for a while too. But really what we're seeing now is lots of new connections across these networks. So this view that looked a little clean in the past, we all knew and we all know now it really isn't this clean. There are so many connections across these networks, and in communities, these are redundant ties that are happening all the time. And what we're seeing is that people are starting new initiatives all the time and almost starting over. So it's been a little hard to almost watch all these great initiatives happen when we know there's a lot of redundancy, which makes community organizations reluctant to join them. We're not really capturing the benefit of them. We're not using that approach of more is not always better. So there's some challenges here in really capturing what we are defining more as an ecosystem, which is really not just members of one network, but all the members of the networks of networks. So, and what we know is that there's lots of little pockets. It's not even just who we're connected to, but we want to know who all of those folks are connected to. So this little picture that's appearing on the right there is much more of what the world looks like today for us. And this is in a community. So this isn't necessarily worldwide networks, but we're really seeing this moving, changing, dynamic network and needing to start answering different kinds of questions, like how can we understand and see all of these networks of networks? How do subsets of them compare to other subsets, and do these interactions change over time? But we still are interested in kind of the subsets of those networks. And so this all feels very complicated and hard to get our hands around. So I want to show you a little bit of how we're trying to think about that. So there's some, with all this complex stuff, I always say that our team loves to measure hard to measure things. And so we look at that and we go, okay, how can we take that and make it a little more simple to get our hands around in terms of being able to measure, understand it, and show it. So this is one of our definitions of ecosystem mapping and tracking. We define this as the identifying and documenting ecosystem members, interactions, interconnections, and perceptions over time across numerous systems, sectors, and programs to improve community health through alignment, coordination, and collaboration. And this is a definition that others have used and we're adopting. This picture I brought to this webinar because this is literally, when you're starting something new, you might draw a picture on the back of a napkin. This was not a napkin, but a scrap piece of paper that my team and I drew together while sitting having coffee. But we started to think about, what does it really mean to measure ecosystems? And what we know is that down here at this level, we have individuals who are trying to navigate these systems. Then we have all these community organizations kind of at this next level that are working together to try to build great systems for people who need to navigate them. And then there's just this whole interaction of people moving through them, and lots of things happening around policy and funding. So our hope is, how do we actually break down these levels while understanding the whole thing at once? So I might come back to this picture as we go through this. What we've tried to do is outline what an ecosystem data tracking and learning system must entail. So we know that people have data, and we can't expect them not to want to use it. So any system that exists needs to be able to bring in the data that already exists, that people have. But we also need ways to collect primary data. There's almost no way to know what real interactions are except the perceptions that we have of each other. My perceptions of you and your perception of me is our real relationship, but it's difficult to capture, and primary data collection lets us do that. So that often happens through surveys or qualitative interviews and things like that. But then somewhere along the way, we must be able to maintain a dynamic data system that can continuously grow and update. So one of our challenges right now is we have ways to collect data, but they kind of sit in this one done space. So building out a data system that can timestamp, that can understand the change of a relationship from negative to neutral to positive and things like that is a real challenge. And something that we have to include. And then finally, rather than just a one and done where we can kind of see that network at a static point in time, ecosystem data tracking means that we need to be able to compare and benchmark across other parts of that system, learn from them, and then continue to build out strategies. So all of this, we hope, feeds into powerful and smart, as we're getting more into machine learning and AI, analytics and reporting to provide insights. And also, we really believe that as these ecosystems grow and become more valuable in terms of what we know about them, it's critical to provide public-facing data repositories, public-facing ways that people can see the data and engage with it. Not only do we believe in the democratization of data when we're working with communities, but this is a resource that if we want it to be effective, we have to have access as members of the ecosystem to see the same thing. In the past, it's been a real kind of power imbalance with people who get the data and get to design it. Okay, so last few things, and then I'll show you how we're doing this. But when we think about ecosystems, there's a really specific way that we view this. So unlike, for example, a CRM, like a community customer relationship management system, where we just have like a bunch of people who we know, this view that we have is around seeing the way they interact. So interactions are made up of members and attributes that describe them, and then questions that we can ask that connect them together. So in our system that I'm going to show you in just a moment, and in the way that we're doing this, we have a member bank, an attribute bank, and a question bank. And so the real challenge is, how do we take all of those and capture interactions by being able to see all of those things at once? So I'm going to go ahead and show you how we're doing this from a kind of technology perspective. So let me just switch screens a little bit here for a minute. Oh, and actually, sorry, one more thing. There are really 3 ways to really track these kinds of relationships. And I want to go through them really briefly before doing this demo. So the first one is really, those of us in organizations are trying to track our relationships with others outside of the organization. So we're not always trying to know every interaction around all of the ecosystem, but day to day, we're trying to keep track of who we're connecting to, how we're building partnerships, and we want to be able to describe those. So that's one way that we want to show you. A second is really just that concept of the one and done's almost. How do we just ask the members of the ecosystem to describe what they're doing and how they're interacting and keep it all in one place? And of course, it doesn't look like this anymore. It kind of looks like this. So how do we capture this first way, this way, and keep them all in one place so that when we want to see them, we can? And then finally, and I don't think we'll have time today to actually go through these, but we also look at this at like an individual's level and the way that those individuals navigate through these ecosystems. So to really capture and track an ecosystem, we need to be able to look at these interactions at different levels. So now I'm going to briefly show you how we're doing that. So we run a software called Partner, and Partner is a way that we capture all of these things in one place. So some of you will have used Partner who are on the call. We have lots of communities who we engage with. And Partner was originally funded by the Robert Wood Johnson Foundation for many years until they asked us to create a sustainability plan and build it out on our own. So if you have been a part of this community using this, you'll see how much we've changed over time. But what we're trying to do is always kind of stay one step ahead of what folks need. And this is where we're at right now. So what I'm showing you right now is called our Partner CPRM. It's a community partner relationship management system. We hope it kind of sounds like a little bit like a CRM. A CRM is a customer relationship management system, and those are used by lots of people who need to track members of a system, members of a community, but those are designed to really create sales funnels and convert people within it to buying customers. And what we're trying to do here is keep track of those kinds of members, but really look at it from an interaction perspective. So what we want to be able to do is track the interactions within the members of our ecosystem. So let's say here that we have Adams County Health as our overall ecosystem. And within that, we have lots of interactions happening. So the neat thing about looking at the world through interactions is that we can continuously track them, build them out, and then our systems can hold that data for us, hold the timestamps, be able to look at that change over time, while we get to capture them just one by one. So just really quick, I'll go back to this front page, and what you'll see is that members of in an ecosystem, I mentioned that there's members, questions, and attributes. So if we have all of these as a bank and we want to capture a new interaction, I can just create one. I can say, this is my webinar on April 11th. And I might want to send a survey out to a lot of you after this to see if you have interactions. So I can go through and pick those folks within my ecosystem that I want to capture an interaction with. And I might just want to pick a few questions for this interaction that I'd like people or myself to answer. And I can always change the date of the interaction too. So what's really different about this is from our one and dones is we used to always send out, whoops, sorry about that. We used to always send out a survey to folks that allowed us to ask questions of the entire ecosystem all at once. And so what we're trying to do now is really look at that differently. So what we want to do is not only look at everyone and how everyone is interacting all of the time, but can we capture those more nuanced interactions, just kind of one-off at a time, and see them in our data system as a whole. So oops, sorry, let me go back to that so I can, sorry, I had two tabs open at once. So I'm going to go back and I'm going to unselect and just pick a couple of my members. And then I'm going to just pick a couple of the types of questions that I want folks to answer. And so what this allows me to do is open a new way to capture that. And so each time that I capture it, I can come back and look at the interaction at its individual level, or I can go back and see the entire ecosystem all at once. And seeing the entire ecosystem all at once is a great way to roll it all up into one, but then also be able to break it down each time. So the second way that we collect data, though, is by sending out these kinds of questionnaires. I'm going to go ahead and start over so I can show you that. So these kinds of questionnaires to the entire ecosystem. So when we do that, we get the level of data that isn't just at my individual relationships as I'm going through my day, but it allows me to look at and ask questions from folks who are part of my whole ecosystem. So at any one point, I might want to come in here and see all the members of that group. And what's really nice about this kind of system is you can see each member one at a time and all the data and information about them. This has been a really important part of the work that we've done, because when we are asking people in communities to give us information and data, we need to give them something back. And community members are so used to being asked to give surveys, but they don't really know where the data go. So these kinds of member profiles are the kinds of things that summarize all of the information that we have about that particular member of the ecosystem. But it's also something we can share back with them. You can either give them a link to show them this or save it as a PDF. If you are running a program and you want to look up the member profiles for the 20 members of that program, you could do that. The data that you're seeing in here is all set up and based on what your needs are. So, you know, the data is only as good as what we set it up to put in here. So we want to make sure that there's really good questions, like what you're seeing here is a kind of validated measure of trust. And that measure of trust is based on 3 different indicators. So those indicators are the kinds of things that we can measure and then look back at in terms of overall scores. So these are kinds of ways that we can capture questions in here, look at these member profiles, communicate with some of the members. And then, of course, there's our whole dashboard where we can see results. And so in a place like this, you might see some summary data. We can export the data into really clean files that look like this. So if you're a data geek, you'll love to know that we are too. And so we can see those. And then just real quick, I'll show you how you might use a system like this to track those kinds of relationships in an exploratory way. So let's say just for a moment that we've done a lot of work and we've entered all that information. What I'm seeing here is a network that we've already captured. And I just clicked to see the early childhood members of that ecosystem. So what I might want to do is say, hey, how are we connecting with our health clinics? So we see a lot of nodes, but still kind of 2 factions here. But we might want to actually come over here and look at, for example, how these organizations interact together. So I can come here and say, well, what if I was just looking for those that have awareness of each other? So I start to see that there are still some relationships there, but if I want to see those who have integrated ties, I can click over here and see as well. So any of the information and data that we collected on the front end will show up here. And I can start to look at it not just only by these different ways that they interact, but I might also want to, for example, filter by different zip codes. I can see there's still a lot of interaction, but there's only one main node here that tends to connect both spaces. But I can look for service gaps around different kinds of zip codes, for example. And I might want to say, okay, let's look at how schools now also interact. So this is a way that we can start to kind of look at this information in an exploratory way, or perhaps map it onto GIS systems with geospatial data, kind of look at network scores. There's always more besides the pictures. I always say the network map is like the front cover of the story of your network. And then the data behind it are what help us really tell that story. And then there's all kinds of information that is not relational, not necessarily related to interconnectedness, but maybe just kinds of data that we want to be able to see, what I call them like our regular ways. And so these regular ways let us track information about, this is at the whole ecosystem level, but you might want to break it down to each of your interaction levels. And the last thing I'll just show you here, and I see Dr. Mays has joined us, so I'm going to wrap it up here so that he can help us think about where this is going for the future. But just real quick, this is a report. There's lots of ways to report this kind of stuff, and communicating this back out is one of the biggest challenges. But what you'll see here is just a report that basically shows the entire ecosystem just kind of all at once. And you might be able to see some impact at kind of a systems level. So for example, which of the following is the most important to achieve for the community? So improving the linkages of children and families to access resources would be number 1. And you can just see all kinds of different things. An interesting one here is there are, for example, perceptions of resource contribution among members, a question that was asked, and you'll see that there is a lot of perception that these members of these networks have good resource contributions. And what the last thing I wanted to say about this is, these questions that you're seeing here, they are part of your question bank. So Partner, for example, has a lot of questions in a question library. Some are validated, some have been used hundreds and thousands of times, and others are ones that you need and that you want to make up and put into your system. So there's lots of flexibility to do that, but there's also lots to build off of in terms of already having a good science and research base behind the work. So I am going to go ahead and stop sharing for just a moment, and we'll get to questions in just a bit, but I wanted to come over here and welcome Dr. Mays. I don't actually, there you are. I hadn't seen you quite on there. So I wanted to introduce Glenn. He is I mentioned earlier, mentor of mine, a long-term friend and colleague. We have been working together, thinking about population and community health systems. And I think you'll find, if you don't already know him, that his research is quite fascinating. I think we share a commitment towards making this work as open and public as possible, while really working on shared measures that we can use across projects, across communities, so we can start to leverage the work of ecosystem building in a more kind of global way, instead of one-offs and one and done. So Dr. Mays, I'm going to hand it over to you for a little bit and let you talk a little bit about your priorities in the work that you do.
Fantastic. Thank you so much, Danielle. And thanks for the chance to join you as part of this webinar. I'm a big fan of this work and the tools and data that Danielle has been bringing to many different sectors. I'm a professor here at the University of Colorado School of Public Health. I'm a health policy researcher, health systems researcher, and I spent a lot of my time studying public health delivery systems across the country, and trying to understand how to help those systems optimize their resources and have a larger impact on population health. And if it's one thing that we know about public health services and how they get delivered, is it's not just government aid. It's not just your local or state health department that needs to play a role in delivering those services. It is a community-wide effort. It's a community-wide ecosystem that needs to be mobilized to actually implement evidence-based public health strategies to assess health needs and risks in the population, to figure out evidence-based programs and policies that can address those risks, and then to implement those programs and policies leveraging all the resources in the community. It's an ecosystem approach, and public health professionals haven't always had the kind of data and insight that is generated through network data and through the kinds of tools that Danielle and her colleagues have been developing. So as I've been studying public health systems around the country for more than two decades now, one of the ways that we study those systems is through a longitudinal survey of communities that I've been involved in leading for more than 2 decades now, called the National Longitudinal Survey of Public Health Systems. That survey tracks about 600 communities around the U.S., and we survey those communities about every 2 years, basically by surveying the local public health officials in those communities, and we ask them which evidence-based public health strategies are being implemented in your community. And for each of those activities, we ask them what kind of organizations are you working with to implement those activities. So it's in that allows us to kind of begin to map out the network, the ecosystem of organizations that are in place in each of those communities that are helping to implement evidence-based public health strategies. And by doing that every 2 years, for years and years and years now, I've started when I was back at a grad student, and we've maintained it over time. We can then look at how those public health networks, ecosystems evolve and change over time, how they get stronger or more dense or attract in more collaborators, and also which communities hit snags and lose collaborators because of a whole host of variety of factors. And so we can look at the dynamics of those public health networks over time, and that's fascinating just in and of itself, to kind of see how things change and to try to understand why things change. But then importantly, we also want to understand, well, what is the impact when these networks change, when they grow and get stronger, or when they shrink or get weaker? What are the health effects that potentially result from those changes in collective capacity to implement public health activities? And fortunately, having done this survey for enough years, we can link the survey data with measures of health outcomes, like measures of mortality and preventable mortality in these communities, measures of life expectancy. We can even link it with economic measures, like looking at medical care spending over time, and to see what effect these changes in network structures have on important outcomes over time. And we found that over time, indeed, they do have significant changes in these public health networks, produce important changes in health outcomes at the population level, and also important changes in economic outcomes. We found that over about a 10-year period, when networks are able to increase their capacity, their collective capacity and density and structure, the strongest networks can actually realize reductions in mortality from preventable conditions of 20% or more. So large health effects at the population level that we can attribute back to the strength of these networks and the changes in networks over time. We've found equally large effects on perhaps our best measure of overall public health, which is life expectancy, average life expectancy in these communities. How long do people live? The strongest networks produce on average about a 3 to 4 gain in life expectancy over a 10-year period when those strong networks are maintained. And on the economic front, we've shown that the strongest networks that over time produce about a 10% reduction in overall medical care spending per person. So they actually save societal resources from needing to spend money on treating diseases when these networks can be more effective at preventing diseases and injuries through their collective capacity. So these kind of data can be used to demonstrate tangible benefits to communities, and we use that not only to help the networks themselves understand the value they're producing for their communities, but also importantly to help policymakers understand the value of this kind of collective enterprise, and to make the case for policy strategies that can help to strengthen and reinforce and sustain these types of ecosystems. Last thing I'll say here, and again, I'm approaching this from, as a researcher from the academic side of the house, but I recognize that and there's lots of people using these kind of methods to study health and social service systems and their effects. One of the challenges I think we face collectively in making these data more widely available and more effectively used, both in policy and practice, is the fact that we're all using different approaches to measure these attributes of ecosystems. I've constructed my own little national survey and figured out how to use, how to capture these data. And there are, research teams all around the country using these same methods to study the same basic phenomenons, but we're all using, very fragmented and different approaches to measurement and data collection. And so we're missing the opportunity to be able to pool data across studies and across populations and settings. And I think we're also probably less effective in communicating the power of these data by that fragmentation. So I think there really is a benefit to figuring out how we can move to a common platform for studying these ecosystems and their effects over time. And Danielle and her team have built an enormously powerful platform. So I think the technology is there. We just need to figure out how to coalesce around it and use it more broadly. So I'll stop there.
Well, Glenn, thank you so much. I fully, sorry, I removed the pin there, but completely agree with you in several ways, except that you just called it a silly national survey or a small national survey, which truly your work has been really meaningful in really big ways. And so I found that funny that you said that, because it's true, though, that we're all kind of doing this as a one-off. And there's some questions today about how to think about what we're measuring. And Glenn has my big dream is that there's some kind of system that we're using, maybe at the community level or state level, that allows us to capture all of these things in one place. And so when a community wants to start a new early childhood initiative or new health and wellness coalition, that we're not starting over, that we're looking at what exists already and tapping into those by looking into the picture of that already exists within some kind of common data system. But like I mentioned before, I think it's absolutely critical that we make those public. And so we have to make those data available to the people in community and not just hold them close as researchers or people who paid for the data. But the only way to really make this community's benefit is really to make these things as public as possible. So that's kind of my call to action as well. But let me just turn it over to see if anyone had any questions for Dr. Mays or myself. And I'll look through the chat to see for a couple that are there. But if anyone does, just please go ahead and unmute and you can just ask it out loud. Okay. I am going to look back at the chat though for a couple of questions. And this one, Glenn, I think both you and I can answer. What resources would you recommend to read about how to think about ecosystems and mapping, one that describes what matters in interactions? I'll say real quick, there's been a lot that has influenced me. I come from a field of public affairs, and in public affairs, you know, our work on looking at cross-sector relationships has stemmed from a lot of the work that looks at bureaucratic government organizations and why they exist and how they can interact with other kinds of organizations. So there's been a lot of folks who have studied this kind of stuff, and one of the primary areas that this is that focus and areas are on efficiency and effectiveness. So there's a lot that folks have written about how do we actually know if this is working, and how do we measure not just the interaction, but how do we measure the outcome and then make a connection between them. Other areas where there's a lot of work on what matters has to do with trust or perceptions of value of interactions. And so we can provide lists of resources of those after, but maybe Dr. Mays, I could ask you, how have you thought about how to know what matters in measuring interactions?
Yeah, it's a great question. You know, a few things one resource that comes top to mind, and another, you know, I think really influential person in this field over time has been network scientist by the name of Tom Valenti. I'm a big fan of his work. I know you are too, Danielle. He wrote a paper, I think, a few years ago. He wrote a paper on how to design network level interventions that I found to be really, you know, just really thought-provoking, and thinking about, again, ecosystems and networks and how to think about how to intervene on those networks in ways that can improve their capacity and effectiveness. And he calls out a number of opportunities and kind of leverage points within networks that I know, you know, it's been influential in our thinking about how to strengthen public health collaboration and public health network collaboration at the local level. So that's another. I think it was in the annual review of public health a few years ago. We can pull that out and share.
Yeah. He also has a book, I think, called Social Networks and Health. Yeah. So that's good too. And maybe I'll mention, I remember him speaking once, and he showed a network map, and he said, don't be afraid to get rid of all the noise. Like, don't be afraid to kind of get rid of those interactions that are less meaningful so that you can focus on those that were meaningful to actually do your work. And it's funny because I was thinking, right, because more is not better always, but there's also a few folks, Brent Millward in my field has done a lot of work on cross-sector networks, as well as Nashir Contractor is someone that I took some courses with. He's from the world of communication. So someone asked if these findings are published, and we can send a list of those after. Dr. Mays has terrific publications that show, and I had a public health director say to me just recently, have you heard of Glenn Mays? He has proven that public health systems improve health outcomes. So we'll make sure to share these resources with you, because from her perspective, she said, I want to use that to justify why we're going to invest in these networks. And so there is data, there are data, and there is evidence to support this work as well. Let me see if anyone has a question. You can go ahead and raise your hand or say it, and then I'm going to kind of continue to look back through here at a few questions. There's a question about Kumu, and one reason we wanted to ask Dr. Mays to come and we wanted to show our tool. There are, and Dr. Mays mentioned there's so many tools, and they do differ slightly. And I think, and we love our friends at Kumu and the work there. That's a network mapping tool. And someone asked what is different, and we focus really heavily on those measures and how we actually measure and get the data in there. And then that's connected to the outcomes and reporting. So the work that we've done is very research-based and evidence-based in terms of trying to create that kind of question structure for folks. So it's a kind of all-in-one tool. And Kumu is a little bit more of a mapping tool where you kind of have to figure out what to put in there and figure out how it comes out. But there's lots of good reasons why you'd want to do both. And then if you continue to follow Dr. Mays, the survey that he does every year is a data set that is rich and longitudinal, and I don't actually know how available it is to the public, but I do know that it's one that is quite referenced often in terms of a resource as well. And let me see. So we're just getting at the end here, and sorry, we should have put them in the Q&A questions as well. So there was one other question that says, I've noticed sometimes the use of coalition, network, collaborative used interchangeably. And so we've noticed that too. And language in this area, our team has a whole task that's called terminology, and we're trying to constantly figure out how to say things. And because these are complex science terms, many of them don't make sense to people who want to use this stuff in practice. And so the use of those different terms are defined often in ways that describe the purpose of the interaction, the coalition, for example, or the outcome intended, or the ways in which they work. But when I showed the network map at the beginning and said we call everything networks, it's because we measure it that way. So we pay a little bit less attention to the different ways that people call these things, because I don't believe there's any real reason that we all need to agree on one thing by which to call this work. But I think what Dr. Mays and I share is that we definitely think there should be some increased consistency on how we measure the things that these coalitions and partnerships and networks are doing, so that we can better understand their usefulness and their ability to be effective. Do you have anything to add on that, Dr. Mays, on terminology and language for helping people understand this?
I totally agree with you. I don't think there's a need to try to all converge on the same terminology. I think we're fundamentally talking about relationships, and we can call them partnerships, we can call them collaboration, coordination, coalitions, and I think it's important is being able to measure those relationships, and then understanding how they affect change.
Okay, well, we are just getting it to the end of this time. I think we could really dig in and spend lots of time on the different ways to do this work, but we will follow up with folks with a lot of those resources. On that very last topic, we have something we call a network strategy document, and it has a lot of definitions of different parts of ways that you might, different factors you need to think about when building a network strategy, from membership, governance, purpose. So we'll share that with you all as well. And it kind of tries to tackle some of these terminology questions as well. But I want to thank you, Dr. Mays, for joining us. You have an incredibly busy schedule, so I appreciate you accommodating us and joining this great group of people who all do work that really matters to the outcomes of people and our populations and communities' health. So thank you all for the work that you do and for joining us today. And we look forward to staying connected. And thank you so much.